as epidemiologists, where do you see the greatest potential for transmission of the disease with the easing of measures? Would it be at workplaces, schools, or the public transport system, or somewhere else altogether? Ying, what's your take?
Well, I think it really boils down to individual practices, and rather than trying to pigeonhole transmission risk with respect to the different types of activities. Because I think if we look globally at countries and regions that have done immensely well, such as what David has mentioned earlier on, such as South Korea, Hong Kong, or Taiwan. For example, in South Korea, their first wave was really because of that small handful of people going to a place of worship even though they were already ill. And right now, South Korea is trying to contain a growing cluster that started with one club-going person and who was hopping between multiple clubs. So while we try to look at the risk for different activities and try and pigeonhole this risk, the reality is that when people are returning to work on site, children are going to schools, the public taking public transportation, all of this risk, all of these activities can be very low risk if everyone is taking the necessary precautions, or they could be very high risk if people are behaving irresponsibly and not taking personal responsibility. And I think this is where I think it's safe to say that nobody can guarantee that when we ease some of these restrictive measures, that there will not be a resurgence. What we do know based on data, say from Singapore and from the rest of the world, is that the coronavirus spreads the best when people are interacting in fairly close proximity, perhaps over an extended time, be it talking, eating together. And I think this is really the reason why many governments, many sensible governments worldwide, as well as the World Health Organization, issued the same reminders around safe social distancing, to minimize physical interactions, good personal hygiene, and right now, including the advice on mask wearing.
Right. So what you're saying, Ying, is that if everybody behave responsibly, we can actually open up the whole of the economy, the businesses, the schools, the pubs, etc., because it's not the type of activity, but whether people interact for long together. Is that what you're saying?
Well, that is what I'm saying, that people have to bear the responsibility. But equally, we as a system, we need to know, we need to stress test the system. We need to know which are the activities that are most likely to result in an increase in transmission. And that is where we have to look at the balance that Yi-Sin talked about earlier on between hospital capacity to treat and allowing economic activity to return. So by having a phased approach, which is not just Singapore having this phased approach, the United Kingdom similarly has a phased approach, you're able to stress test the system to find out exactly which are the type of activities that after a period, perhaps 2 to 4 weeks of easing, there are no real emergence of new cases, but there could be other activity, perhaps such as nightclubs, that when people come together, it spreads so quickly and you need to reshut that sector again.
Right, thank you, Ying. David, could I turn to you? What do the experts think are areas that are more likely to cause transmissions?
Well, that depends on what the economic and the activity is in the country, the economic activity and whatnot. And what's important is to do a risk assessment in each sector to see where transmission has occurred in the past and where it might be safe to open up first. So a phased in unlocking is very important, as is being done in Singapore and other places, looking at the risk assessment and remembering that underpinning all this must be understanding by the population of how to protect themselves and how to protect others. So in parts of Europe, for example, where they've continued to do contact tracing and identification of all those people who are infected and isolating them, they've been far ahead in opening up. And when they've opened up, they haven't seen a resurgence of cases because they have systems in place to monitor where disease might be occurring, and they can lock down if necessary. Other countries are just beginning to understand transmission, and they'll be unlocking as time goes on. But I think the risk assessment is very important in this, knowing where to unlock first and making sure that people understand how to protect themselves and others. And that includes enclosed spaces, such as the underground in London or various other places where there isn't a possibility to physically distance, everyone must be wearing a mask properly to protect others. This is very easy in parts of Asia because it's a custom there for many, many years to protect others when one is sick. But this isn't a custom in Europe, and it's something which will have to be adapted as time goes on.
David, based on international experience, how risky is it to allow all retail outlets, restaurants, bars, etc. to open for business, but with people taking care to mask themselves and have social distancing in place? For example, with restaurants, will it make a difference if people were sitting outside the restaurants instead of inside?
Well, we're learning now as time goes on, and many restaurants in Europe have opened up, but only outside, while others are opening up inside with physical distancing between tables. So we'll see what that brings, and I think they'll always be ready to lock down again if necessary. And that's why what Yisun and YY have both said, it's very important that we learn as we go ahead. We've already learned that this disease behaves much differently than influenza. Everybody was prepared for influenza in the rest of the world. Asia was prepared for influenza and also a coronavirus, and that difference shows because you've continued to treat this as discrete outbreaks where you could stop discrete outbreaks, whereas in many European countries, they just locked down the whole sector, stopped doing their contact tracing, and went to pure mitigation, closed down social events, closed down areas where people congregate, closed down businesses, and as a result, they're now beginning to see that they have to exit, and people have to learn to live with this virus.